Hello, Miss Jane Doe. My name is Brooklyn. I'm going to be your nurse today, and I'll be showing you how to check your blood glucose. I'll tell you when to check your blood glucose and how to dispose of your lancets. So I understand you have type 2 diabetes and you've been recently diagnosed and you have a little bit of a fear with needles. Is that correct?
Yes.
Okay, so I'll be showing you how to do this. So first I'll go over the blood glucose range. So the normal range is between 4 and 7 millimoles per liter. So if you're out of this range, I'll give you some information that you can look on afterwards, and I'll let you know right now. So if it's too low, you can try having a snack and monitor more frequently. And if it's too high and you're still feeling symptomatic, then you can try maybe avoiding some sugary foods, and your dietitian will give you some more information on that. But if you're feeling symptomatic and your levels are way beyond these limits, then it may be a good idea you should seek help. So you should take this in the morning, first thing you wake up, before your meals, when you're sick, maybe a bit more frequently, and at bedtime. So I'm going to show you how I do it. So I'm going to wash my hands first and clean my hands. This is our device. So this is my lancet. This is where the needle is. And so we won't actually be seeing it. So I'm going to put this in here. I'm going to click twist to open. There's no needle here yet. So I'm going to click this in and align it with my grooves. Click down. So my needle isn't exposed. I'm going to hold down here. Pull directly up so my needle's exposed now. So I'm going to put my cap on and twist to close. I'm going to pull back my plunger. And this is the spring that loads the needle into your skin. So now what I'm going to do is I'm going to get my glucose test strip. This is my glucometer. Here's my on button. I'm going to insert this into the bottom with my metal strip going upwards. I'm going to get my alcohol swab and choose a finger. And I like to rotate them so there's not too many pinpricks on my fingers. So you wipe this for 30 seconds, let it dry for 15. I'll press this button and I'll hold this flush to my skin as well. So there's no needle right now until I press this button. So I'm gonna poke. I'm gonna have my blood here. If there's no blood, then I can try giving it a little push here on my finger, as such. And I'll put the metal strip up to the droplet of blood, and my number will show right here. And there's a little indication here in case you forget, and it'll show you reminder that you need some blood. So to dispose of my lancet, I'll be twisting my cap off. My exposed needle is here. So I'm gonna take this upwards and I'm gonna put this in my sharps. So I'm gonna reset this for you to go and try it on your own. Would you be comfortable with that?
Sure.
Okay. If you have any questions, feel free to ask me throughout. So here's your glucose test strip, here's your glucometer, your device to put your lancet in, and your lancet.
So fresh lancet, open my device, insert the lancet into the device till I hear the click, pull the cap off, put the top on the device, pull back the plunger, get my glucometer, fresh test strip, insert it into the glucometer. I would take an alcohol wipe, sanitize the tip of my finger, hold the device flush with my skin, hit the button, get the prick. I would massage until the blood came and I had a droplet, and then I would hold the metal strip to the blood droplet and then get my reading. I would then dispose of my lancet into a sharps container.
Okay, perfect. And now I'm just going to get you to tell me why it's important to take your blood glucose and monitor it regularly.
It's important because I need to know where my body is sitting. If I'm not feeling well, then maybe I can check my blood sugar and see if that's the reason why. If it's too low, then maybe I should go get a snack. If it's too high, then maybe I should avoid having some snacks. And if I'm really not feeling good, I can check it. And if it's way out of the normal range, then maybe I should go to the hospital or call someone to give me some help.
Absolutely. So this helps to give a baseline for our physician as you're newly diagnosed, and we can help to better manage your condition or increase your medications or lower your medications. So I'm going to put this back on and reset, and we're done.